Hi everyone. In today's clip, I will talk a little bit about herb and drug interactions. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, herb-drug interactions happen when herbal supplements interact with medications, potentially altering their effects, either by decreasing or increasing drug concentration or by causing toxicity or reduce their efficacy. These interactions can also impact the absorption, distribution, metabolism, and also excretion of the drugs. There are two known mechanisms of drug-herb interactions. There's one which is pharmacokinetic interactions. These involve changes in how the body processes a drug, for example, the absorption, as I mentioned, distribution, metabolism, and excretion due to co-administration of a herbal medicine. Then we have pharmacodynamic interactions. These involve synergistic and antagonistic pharmacological sort of effects, meaning the herbal supplements can either enhance or counteract the effects of the medication. I thought it would be beneficial to sort of talk about the ones that are most common and provide a bit of info on how they sort of may react with each other. Of course, this is different from one person to the other because the list is not obviously exhaustive. Keep in mind that the chemicals produced internally due to our feelings, thoughts, and emotions also play a huge role, a major role in all these interactions, and they have their own interaction levels. So this is why the side effects of a medication can be pages long, as we will never know what chemicals internally the person is producing. So let's go through some of them. We have, for example, black cohosh. This may reduce effectiveness of statin drugs like Lipitor and show elevated levels of liver enzyme. Then we have ginkgo biloba. This may potentially increase the chance of bleeding if the person is on blood thinners like warfarin or alike. We then have American ginseng, which can interact with medications that prevent blood clots, for example, aspirin and other non-steroidal anti-inflammatory drugs or NSAIDs, corticosteroids, digoxin, estrogen therapy, monoamine oxidase inhibitors. These are used to treat depression, basically, and medications that decrease blood sugar levels, like anti-hyperglycemic medications used to treat diabetes. And combined with certain medications, it can also impact heart rhythm. Then we have milk thistle. This may decrease or increase effectiveness and metabolism of some medications such as warfarin, diazepam, which is anxiety and muscle spasms, Valium, and medications for high cholesterol, infections, insomnia, and blood pressure. Then we have golden seal, and this one is strongly recommended to avoid with any medication, including over-the-counter, because this herb has 5 major drug interactions, as well as 104 moderate and 17 minor. Always check before you mix. Then we have St. John's wort, which can interact with numerous medications, potentially reducing their effectiveness or increasing the risk of side effects, particularly with antidepressants, birth controls, and immunosuppressants. It decreases the effectiveness of digoxin, which is a heart medication, as well as warfarin, which is the blood thinner, asthma medications, HIV medications, and more. Then we have echinacea. This interacts with medications that are metabolized by certain specific enzymes, including antipsychotic and antidepressant medications. It has two major, 339 moderate, and 97 minor interactions with drugs, which you need to check into, obviously. So then we have garlic extract, and this has been shown to decrease concentrations of some drugs, and has 8 major, 41 moderate, and 141 minor drug interactions that needs to be checked before use. Then we have green tea extract. There are about 14 known drug interactions with this remedy when it comes to heart failure and heart attack medications, as it interacts and brings the blood pressure up. Also, it contains vitamin K, which can increase blood clotting and interfere with blood thinners. So those who are on statin medication should be double checking with their healthcare provider, as this may cause serious side effects like severe muscle tissue breakdown or even liver toxicity. Then we have kava kava. This remedy has 11 major, 265 moderate drug interactions, some of which are schizophrenia and antihistamine medications. Never mix this herb with antidepressants because it can definitely oversedate the person. And also because it inhibits sodium and calcium channels, it may cause direct decreases in systemic vascular resistance and blood pressure. Then we have saw palmetto. There are 26 minor drug interactions with this herb, and some drugs that may interact with this include estrogens, medications, and herbal products that may increase your risk of bleeding, including blood thinners, such as warfarin or heparin, and antiplatelet drugs, and more. Next, we have valerian, and this can increase the effects of other sleep medications. It also increases the sedative effects of depressants, such as alcohol, benzodiazepines, and narcotics. And it may interact with St. John's wort as well. Then we have ashwagandha. This has 7 major, 259 moderate, and 180 minor drug interactions. Ashwagandha should not be combined with medications for thyroid, blood thinners, immunosuppressants, sleeping pills, sedatives, antihistamines, anti-diabetic medication, contraceptives, anti-epileptic, or blood pressure regulators, as it weakens or exacerbates the effects of the drug, so which negatively will impact, of course, health. Then we have chamomile. There is 1 moderate and 52 minor drug interactions with chamomile. Chamomile may interact with certain medications, potentially increasing bleeding risk with blood thinners and enhancing the effects of sedatives. Chamomile might sort of interfere with the effects of tamoxifen, hormone replacement therapy, and estrogen-containing oral contraceptives. There are also reported interactions between chamomile and cyclosporin, which is a drug used to prevent transplant organ rejection. It also reduces the effectiveness of statin medications. Then we have ginger. There is 1 major, 72 moderate, and 9 minor drug interactions. Ginger may interact with prescription and over-the-counter medication, and it may increase the risk of bleeding if you take blood thinners such as warfarin, Coumadin, Plavix, or aspirin. Ginger might sort of slow blood clotting. So taking ginger along with medications that also slow blood clotting might increase the risk of bruising and bleeding. Then we have peppermint. Peppermint can interact with antibiotics, antifungal, or anti-seizure medications. Also, it's not recommended for those with kidney or gallstones. Then we have mugwort. Mugwort can promote blood circulation, potentially increasing the risk of bleeding. If you are taking any medications that also raise bleeding risks, it is best to avoid mugwort or talk to your healthcare provider before using it. Don't use mugwort if you are allergic to daisy family of plants, which include ragweed, chrysanthemum, marigold, and chamomile. Then we have feverfew. This can interact with certain medications, particularly those that affect blood clotting and those metabolized by liver, potentially increasing the risk of bleeding or altering the effects of other drugs. Feverfew can slow the blood clotting, so potentially increasing the risk of bruising or bleeding when taken with medications that also slow blood clotting. It can also affect how quickly the liver breaks down certain medications, so potentially altering their effects and side effects. So these are a few of the herbs that I could think of. Always double check the interactions before you take any combination of herbs, supplements, or medications. It's important to note that, of course, these herbs all have many benefits, many healthy benefits. It's just when they are mixed with chemical medications or certain physical issues or any other herbs or supplements that they can become harmful. Some things that work well on their own may not like teamwork. Hope this has been helpful. Like and follow for more. Be the light.